Assalamualaikum warahmatullahi wabarakatuh. I am Mariam M. De Sumimba and I will be discussing the second part of our report, which is the therapeutic process in reality therapy. This discussion includes the therapeutic goals, therapist's functions and role, client's experience in therapy, and the relationship between the therapist and the client. But before we proceed to those topics, let us first have a short recap on the introduction and some of the key concepts that were discussed by Ms. Piastro in the first part so that we can relate it to our discussion later. According to reality therapists, they believe that the underlying problem for most clients is just the same. So they are either involved in a present unsatisfying relationship or they lack what could have been called a relationship. So usually ang problema ng mga clients are their inability to connect, to get close to others, or to have a successful or satisfying relationship with at least one significant person in their lives. So, ang ginagawa ng therapist is that ginaguide nila yung patients kung paano sila magkakaroon ng satisfying relationship with other people. So, ang paniniwala nila is the more the client are able to connect with people, the greater the chance that they will experience happiness. So basically, the therapeutic goals of reality therapy are first to help the clients get connected or reconnected with the people they have chosen to put in their quality world, and to help clients learn better ways of fulfilling all of their needs, including achievement, power or inner control, freedom or independence, and fun. So what the reality therapists are doing is that they assist clients in making more effective and responsible choices related to their wants and needs. So, ang pinakamalaking tanong ng reality therapist sa kanilang mga client ay kung ang ginagawang behaviors ba ng client ay nakakatulong para ma-achieve yung needs and wants nila. Now, there are a lot of situations or instances that clients come voluntarily for therapy. And accordingly, itong mga clients, sila yung pinakamadaling tulungan. However, isa din sa goal ng reality therapy is kung paano maaagapan or tutulungan yung increasing number of involuntary clients dahil sila yung may malaking tendency na i-resist yung therapist at yung therapeutic process. And accordingly, these individuals often engage in violent behavior, addictions, and other kinds of antisocial behaviors. And that is the reason why the counselor needs to do whatever they can to connect with these involuntary clients. Because if the counselors could not connect with their clients, then it is not possible for them to provide significant help. But if the counselor can make a connection, they can begin the goal of teaching the client how to fulfill his or her own needs on his or her own. Moving on to the therapist's function and role. So the therapeutic process in reality therapy is considered as a mentoring process wherein the therapist is the teacher and the client is the student. So yung main role ng therapist is to challenge the clients to examine what they are doing. And what they do is that they teach their client to engage in self-evaluation. And this is usually done by raising questions like, is what you are choosing to do getting you what you want and need? So by doing this, parang nakakatulong yung reality therapist na i-assist yung kanilang client na i-evaluate yung mga own behavioral directions nila or yung specific actions, wants, perceptions, level of commitments, or yung possibilities of new directions at yung action plans na pwedeng i-take ng mga clients. So, in this way rin, natutulungan yung client na mag-decide ano yung mga gusto niyang baguhin sa sarili niya at mag-formulate ng plan para ma-facilitate yung desired changes niya sa sarili niya. So, according to Wobolding, yung outcome nitong process is better relationship, increased happiness, and a sense of inner control over their life. So in terms of function naman, yung reality therapist serves as an advocate who instills the idea that there is hope. So kahit ano pa man yung na nangyari sa client, no matter how bad things that has happened to them, the client is still capable of overcoming those challenges. So yun yung main function ng reality therapist. Let us now move on to the client's experience in therapy. So in reality therapy, clients are not expected to focus on talking about their past experiences, nor talking about their feelings that are separate from acting and thinking that are part of the client's total behaviors. And they also don't really talk about the symptoms of what they are going through, but rather, the emphasis of the therapy is on action. Kasi accordingly, it is believed that when clients change what they are doing, they often change also how they are feeling and thinking. So if we would go back to one of the key concepts of reality therapy that was discussed by the previous reporter, it includes keeping the therapy in the present. Now, what do we mean by keeping the therapy in the present? So, many people are convinced that clients in the therapy should revisit their past in order for them to be helped. And there are also a lot of therapeutic models stating that to function well in the present, people must understand and revisit their past. But for Glacier, he disagrees with this assumption and he contended that whatever mistakes were made in the past are not important at the moment or now. So again, ang sinasabi sa choice therapy is that pwedeng makakontribute sa current problem yung past experiences ng isang tao, pero the past is never the problem. So to function effectively para kay Glacier, people need to live and plan in the present and take steps to create a better future. Kasi we can only satisfy our needs in the present and not in the past. But it is also important to note that the reality therapist does not totally reject the past. However, they will only give enough time to listen to past failures of the client para i-assure yung client na hindi sila nire-reject ng therapist. Or kung yung sinishare ng client is about positive experiences about their past, nakikinig mabuti yung therapist kasi there is a possibility daw na maulit yung ganong situation or yung ganong positive na experience nila. So again, the clients are gently but firmly challenged to undergo through self-evaluation process, which is the cornerstone of reality therapy. Sa relationship between the therapist and the client, reality therapy emphasizes an understanding and supportive relationship between the therapist and the client. So this is also known as the Therapeutic Alliance, which is the foundation for effective outcomes. Now, for the involvement between the therapist and the client to happen, the counselor must have certain personal qualities, including warmth, sincerity, congruence, understanding, acceptance, concern, respect for the client, openness, and willingness to be challenged by others. Also, Wobbelding identifies specific ways for counselors to create a climate that leads to involvement with the clients. And this includes using attending behavior, listening to clients, suspending judgment, doing the unexpected, using humor appropriately, being oneself as a counselor, engaging in facilitative self-disclosure, listening for metaphors in the client's mode of self-expression, listening for themes, summarizing and focusing allowing consequences, allowing silence, and being an ethical practitioner. So once involvement has been established by the counselor, they can assist the clients in gaining a deeper understanding of the consequences of their current behavior. So that is all for my report. I hope you have learned something. Thank you.